Thanks for staying with us. So we have the Commissioner for Information, Delta State, Mr. Charles Aniagwu. Good morning, sir. Are you there?
Good morning. Thanks for having me.
Yes, good to have you. So we read in the papers today that you lost one person to COVID, I think it was yesterday. What was even more disturbing about that story was the fact that the person had gone to NCDC, told them of his condition. They did their test for him and asked him to go back home. By the time NCDC called him back, they found that he was dead. My question, therefore, is what's the procedure in your state on how to help or to engage those who come forward for to be tested?
Well, thank you very much. Let me make it clear that our procedure here is not different from what you have in Lagos, in Abuja, and indeed every other state where NCDC has done quite well. You do know that the process is that once you feel sick and you have some of the symptoms already identified with COVID-19, you are expected to call certain numbers, which were made very, very public. We have as much as 4 of those numbers that were given out to members of the public. But beyond that, we also said, if you feel any of the symptoms, whether you are having dry cough or possibly you're having running nose, body pain, or some form of pains, or any feverish feeling, you can also contact your councillor, your local government chairman, or the executive secretary in charge of health at the local government level. So we have a number of persons that you can reach out to for the purpose of also escalating the development to the disease surveillance officers that we have across the 25 local government areas in the state. There are some individuals which you do know, not only in Delta, sometimes when they take ill, they prefer to either begin to embark on some form of self-medication, which they have done over the years, and you know how difficult it is to change certain primordial sentiments. And what you need to understand is that at a time like this, is even when you have body pain that you may have had before, it's important that you report it because you may not know what it is. Those who are in the medical profession have made it very clear that COVID-19 being novel and new, that it comes with different forms of symptoms, that the symptoms are not unique across individuals. Some persons are even asymptomatic, and in which case they may not be showing any of the signs, but yet they are positive when tested.
Right.
So the fact is that the person reported late and obviously has some underlying ailments or some form of what you may call some comorbidity.
Have you started, I'm sure you started contact tracing to know who he's been with and to know if indeed he has had contact with somebody who traveled or this is a communal transfer. How far have you gone with that source?
You do know that at this level, across the length and breadth of the country, we're already experiencing a community transmission. So even when you ask questions as to whether you have traveled to places that at the moment have become high risk, places like maybe Lagos, Abuja, or even Kano has now joined a number of states, even our neighboring state, those states is gradually also becoming a high risk state, given the number of persons that have been confirmed positive. And so even when you want to beam your satellite along that particular line as to who you may have been able to interact with or come in contact with, we are quite sure that the virus has now moved beyond the issue of your travel history because of some level of community transmission. But in any case, we have also embarked on a series of surveillance, tracing of contacts, and then we have a number of them in our surveillance. Some of them have been let go because 14 days incubation period for the virus to have manifested have been elapsed, and as such, those persons are allowed to also proceed with their personal businesses. But in the course of that, we ask individuals that are traced to anybody that has been confirmed positive at this level, because the capacity to continue to do door-to-door testing is not yet here with us, not only in Delta, but even across the country. And so you ask them to self-isolate while we monitor them on a daily basis. We have deployed a number of vehicles for the purpose of contact tracing, and that will continue to do. We plead with our people that whenever you fall ill or feel any sign that is not usual with your body at a time like this, it's not the one that you need to just rush to a pharmacy store and just begin to buy drugs.
Okay, all right, let me get a few more questions for you.
Are you receiving funding from the federal government? Or have you received any funding from the federal government?
At the moment, apart from the support we are getting in terms of personnel from the NCDC, I'm not aware that we have received any funds at this moment. But we do hope that the federal government will come in. Even the palliative that came, we still have some challenge with some of the products, that is in terms of the three trucks of rice. But we do hope that the federal government is working out the modalities to reach out to not only Delta, but a number of other states.
Oh, do you have weevils in your rice too?
Here.
Do you have weevils in your rice too?
Pardon?
Do you have weevils in your rice?
You said what?
Or your state government had complained that they had weevils in their own rice. Are you saying you have the same issue in your state?
I think the audio is not actually coming clear.
Okay,
is your rice clean? Is your rice clean?
Okay, if we have issues with the rice?
Yes.
Yes, we do. We do with some of the bags. And obviously, when we treat it, maybe some of them because of the way they were stored. And we are also very, very careful. And that's why we also want to take advantage of NAFDAC. Whatever that comes in, they should be able to certify that it's good enough so that whatever gift anybody is giving us, not only the federal government, we ensure that it's something that our people can consume. But let me also inform you that we have also discharged 2 of our 7 active cases. The 2 that we lost actually died even before their results came out positive. So it's not as if they died in a facility per se, because they showed up late. That's one. And secondly, they also have some form of underlying sicknesses, which you do know, according to medical experts, is not too good with COVID-19. Then the 3 active cases, by the grace of God, that we have now are doing quite well. Just yesterday here, by the grace of God, too, we were able to set up, in collaboration with Irua Specialist Hospital, our testing center. So now we don't need to travel to Edo State to conduct our test. We can do that right here in Asaba.
Great. All right.
And that is also an advantage.
Right.
So the governor announced on Tuesday that there will be a partial easing of the lockdown within the state. Why? What informed that?
Well, we have examined the 28 days that we had the total shutdown of the state, both its impact on the economy of the state and the fact that we have also done a level of sensitization to the extent that those who may be doubting before now that COVID-19 had the capacity of infecting and indeed killing an African, that is not the truth. So with that level of knowledge, we are comfortable that our people can, to a very large extent, also take personal responsibility. But that is not also without some form of adjustment. With the governor have also directed that for those who even be out there on the street, it is compulsory that the moment you want to come out in the public, you need to wear your face mask. Good enough, we have, as a state, been able to produce and distributed 1 million pieces of the face mask, while also pleading with well-meaning individuals to fill in the gap. And I can report to you that a good number of Deltans and others have assisted us in providing palliatives. And so having secured that kind of support from members of the public, we're also confident that a number of persons at their local level will also be able to provide some of these needs, particularly face masks, so that beyond the 1 million the state government has produced and distributed freely, other individuals can also afford to fill in the gap.
Okay.
But we also made it very clear that it's meant for the very vulnerable, so that those who can afford it can get their own by themselves.
Because Delta is not without any cases, and contact tracing is tough. Any plans to increase instead of the suspect cases testing to door-to-door testing to improve the number of tests you carry out daily?
I think the audio is not coming across clearly.
Any plan to increase the number of tests that you carry out daily, door-to-door?
If you may repeat the question again, please.
Are you planning to increase the door-to-door testing? Are you planning to increase the door-to-door testing?
The audio is coming quite low, and so I can't get the question.
I do apologize about that, but we'll try to sort out that technical issue. But we just wanted to know if Delta State is planning to do a door-to-door test. If our producers can call him back, maybe we can speak to him via audio.
If we are planning ahead, what if Delta State is planning?
Testing, more door-to-door testing.
Yes.
Okay. If we are going to continue, yes, we do. But of course, you do know the capacity. We don't also want to begin to promise what is not going to be very, very traceable. At the moment, we are doing more like on case basis. The moment you show up certain symptoms, or that you show up and we discover that you fall within the case definition, yes, to subject the person to test. But
those
we
are
can't promise you now that we can begin to go from house to house. It's not happening anywhere in the country. And this is not a disease where you need to begin to do probability sample and say, okay, let me test A in a family. So once A doesn't have it, means everybody in the family is free. That is not true. And for us, we don't do politics with issues that have to do with the health of our people. And so nobody will just want to promise you that we're going to take the one center that we have. Beyond being just one center, what of the reagents? You may not, I'm not talking about the cost alone. You will need to be able to also have enough reagent for you to now hit the streets and begin to test from house to house.
Have you
gathering samples?
Have you reduced interstate travel? Are people allowed to come into your state, or that's been totally?
Yes. We are just like most of the other states. Starting from today, we also barricaded our boundary. You do know that, except for, of course, for those other classes of service providers that the federal government have rightly spelled out. We have done that, but beyond that, we said individuals also need to take a measure of responsibility. We have also instructed the security agencies to enforce the directives that the federal government gave, in addition to the other directives that we have here at the state. We have made it very, very clear. Today, we are meeting with the religious bodies sometime this morning to also let them know and discuss with them the way forward with respect to religious gatherings.
Okay, we have to wrap up.
The number of other gatherings are, for the moment, prohibited,
right?
Because we do believe that such gatherings have the capacity of escalating the spread of the virus, and we just do hope that our numbers don't spike.
Okay,
because,
I do worry though, sir. I do worry because you're just closing down your borders today, and that's about 6 weeks after. And that
before now, we have our borders closed. I'm only saying reinforcement of the new directives.
Right.
Since the 28th of March, we have our borders closed.
Okay, just checking. All right, thank you
so
so much.
For more than 1 month, we have had our borders closed.
Great. Thank you for checking in with us this morning. Appreciate it. We've been speaking with the Commissioner for Information, Delta State, Mr. Charles Aniagwu. Let's go on a break. We'll be right back.
Stay tuned. Your View will be right back.